Good afternoon, good morning, and good evening, everyone. Thank you all so much for joining us on this webinar for the World NTD Day celebrations. My name is Agazi, and I am the Program Manager for the Kikundi Community of Practice for NTD program managers across Africa. Today's session is packed full of very interesting presentations and talks from various experts and partners in the field. As you might have seen at the beginning, interpretation is available for English, French, and Portuguese. Make sure you are in your correct channel. Today, I'm excited to moderate this webinar we've organized in close partnership with our collaborators and partners in the field. These include the African Union Commission, African Leaders Malaria Alliance, ESPEN.WHO, and of course, Kikundi Community of Practice and Speak Up Africa. So we have presentations from all those partners, and we will also be hearing from NTD program managers who are members of the Kikundi Community of Practice. So if you have any questions that you would like answered during the presentations, feel free to use the Q&A function that you see at the bottom of your screen, and we will try to address those questions throughout the presentations. Now, without any further delays, I would like to welcome our first speaker in order to open our session for today and kick us off in our discussions. The first speaker is going to be Her Excellency Ambassador Amma Twum-Amoah. She is currently the Commissioner for Health, Humanitarian Affairs and Social Development at the African Union Commission. And she will be addressing the political case for integration and investment within the field of NTDs. Your Excellency, if you are in the call, I would like to hand over the floor to you so that you can get us started on today's webinar. Okay, I have been informed that Her Excellency will be joining us shortly. But while we wait for her to join, I would like to welcome Professor Julio, who is the Director of Health and Humanitarian Affairs at the African Union Commission, for some welcome and opening remarks. Over to you, Professor.
Distinguished participants, dear partners, dear colleagues, Africa bears 35 to 40% of the global burden of neglected tropical diseases, and every country in the African Union faces at least one endemic neglected tropical disease. This reality underscores why the African Union's roadmap towards 2030 and beyond represents a major shift from a fragmented fight against diseases to a unified, continental, African-led approach. On behalf of the African Union Commission, I am honoured to welcome you to this virtual meeting commemorating World Neglected Tropical Diseases Day. I extend my warm greetings to my colleagues across the continent and to our global partners who stand united in our mission to end suffering caused by neglected tropical diseases in Africa. I would like to acknowledge our co-organisers, the African Leaders Malaria Alliance and Fund, the World Health Organization, the Kikundi Community of Practice, Speak Up Africa, and Uniting to Combat NTDs. Your partnership continues to support the Commission's efforts towards a continent free of neglected tropical diseases. This year, 2026, marks the midpoint towards our 2030 elimination goals. Let us take the time to reflect and renew our commitment in support of this call. Our upcoming theme, integrating and advancing the fight against neglected tropical diseases through integration into primary healthcare and sustainable financing, calls for us to strengthen integration and re-examine the funding mechanisms for these diseases and conditions. The elimination of neglected tropical diseases remains key to ensuring health security and universal health coverage in Africa. The African Union has laid the groundwork for progress and provides strategic guidance through the Continental Framework for the Control and Elimination of Neglected Tropical Diseases in Africa by 2030, which also emphasizes sustainable domestic financing, real-time data collection, and accountability. Today, I encourage you to identify practical and effective approaches to integrating neglected tropical disease interventions into primary healthcare for services to be available wherever our citizens seek medical care. This integration must be supported by predictable and predominantly national funding to ensure long-term sustainability. To achieve elimination, our collective efforts must also be guided by data-driven and climate-sensitive planning. Ladies and gentlemen, Agenda 2063, the Africa we want, envisions an Africa where all citizens can enjoy good health and well-being, free from the burden of preventable diseases. This vision cannot be realized as long as 600 million people remain at risk of contracted, neglected tropical diseases. It is our responsibility to close this gap. In conclusion, I encourage you to commit to concrete solutions, to sharing experiences between countries, and to learning lessons to accelerate our progress towards 2030, because Africa is counting on our commitment and collective action. Thank you.
Thank you so much, Professor Julio. I think the important points to pick up are the need for integration, the need to have predictable national funding, and also the importance of having shared experiences and knowledge amongst NTD program managers and NTD programs is very crucial to the elimination of NTDs. Thank you once again, Professor Julio, for that speech. Next up, I would like to welcome the keynote address around the political case for integration and investment of NTDs. Her Excellency Ambassador Amma Twum-Amoah, who is the Commissioner for Health, Humanitarian Affairs and Social Development at the African Union Commission. Over to you, Your Excellency.
Thank you very much. My dear sister, Madam Joyce Phumaphi, distinguished delegates, ladies and gentlemen, warm greetings to all of you. Today, as we commemorate World Neglected Tropical Diseases Day, we stand in a moment of continental solidarity, a renewed commitment to ending diseases that have long undermined the health, dignity, and development of our people. Neglected tropical diseases continue to afflict millions across Africa, disproportionately affecting those living in poverty, in remote communities, and in fragile settings. These conditions are preventable and treatable, yet they persist due to continued gaps in access, financing, and health systems. With fewer than 4 years remaining to achieve the 2030 targets, we must now translate commitment into sustained and coordinated action. One thing is clear: NTDs are not only a health issue, they are a development issue. They reduce productivity, perpetuate inequality, and weaken the health systems upon which our societies depend. Eliminating these diseases is therefore integral to our continental agenda of universal health coverage, resilient systems, and inclusive socio-economic transformation. For our elimination efforts to succeed, country ownership and sustainable domestic financing are essential. While global partnerships remain important, reliance on uncertain external funding leaves programs vulnerable. African governments must prioritize predictable domestic investment in primary and community health systems. Without reliable funding, NTDs programs will remain exposed and hard-won gains will be fragile. Equally important is integration into primary health care. NTD prevention, diagnosis, treatment, and follow-up must be delivered alongside immunization, maternal and child health, nutrition, and other essential services. Integration improves efficiency, strengthens frontline health workers, and ensures the most vulnerable are not left behind. Universal health coverage will remain incomplete as long as affected communities lack access to essential services. Furthermore, climate resilience and regional cooperation must guide our strategies. Changing rainfall patterns, rising temperatures, floods, and droughts are already altering vector and increasing the risk of disease resurgence. National and regional climate adaptation plans must explicitly address NTD risk. As with most infectious diseases, NTDs do not respect borders. Aligned mass treatment campaigns, harmonized surveillance, and joint contingency planning are therefore critical to preventing reintroduction and safeguarding elimination gains. All these efforts, however, cannot succeed without robust data, research, and African-led innovation. Surveillance systems, timely and accurate data, and early detection of resurgence are vital. Increased investment in research, locally appropriate technologies will yield diagnostics, treatments, and delivery approaches tailored to African context. Above all, these efforts must be guided by equity in every decision. The poorest, most remote, and the marginalized communities continue to bear the greatest burden, and our policies must remove financial, geographical, and social barriers to ensure no one is left behind. Distinguished delegates, as I conclude, I would like us to reaffirm our shared responsibility to move decisively from ambition to implementation by aligning actions with the AU Roadmap 2030 and beyond and Agenda 2063, the Africa we want. We will translate commitments into measurable progress for health, resilience, and inclusive development. Agenda 2063 envisages a prosperous integrated, peaceful, and inclusive Africa driven by its own citizens. Therefore, eliminating NTDs is essential to realizing this vision. I urge our member states, therefore, and regional institutions, civil society, the private sector, and development partners to accelerate concrete actions so that NTDs become a chapter of history on our continent. I thank you.
Thank you so much, Your Excellency, for the opening remarks. And I think we all agree in the importance of trying to organize the plan of elimination around the African Union's ongoing agenda, and also all the points you raised in terms of the importance of integration, as well as ongoing surveillance of achievements that have been made so far. So thank you so much, Your Excellency. To build up on what was already shared, I would like to now welcome Ms. Inas Mubarak Yahia, who is the head of division of Health Systems, Disease and Nutrition of the African Union Commission. And she will be telling us about the African Union's strategic vision for NTDs over the next several years. Over to you, Ms. Inas.
Thank you very much, Mr. Agazi, for the introduction. Greeting from African Union Commission once again, and thank you very much for the opportunity to be part of this very important and critical webinar addressing and commemorating World NTD Day. Today is a very important day for all of us, and I believe this is also an opportunity to take a very solid recommendation and action. It is my honor to present today the AU roadmap. Next, please. Thank you. It is my honor to present the AU roadmap to 2030 and beyond, sustaining the AIDS response, ensuring system strengthening and health security for the development of Africa. This policy document has been endorsed by our ministers and member states back into 2024, and it's now being domesticated and shared by all our member states to fulfill their commitment. So the purpose of this roadmap is envision ending AIDS, TB, malaria, improving maternal health, addressing endemic, non-communicable and neglected tropical diseases and condition in Africa by 2030. And if we recall what Commissioner has said, this document is fully aligned with our other policy documents, one of which the Africa Health Strategy 2016 to 2030. So that alignment will also give us the opportunity to make sure that we are all in coherence when it comes to our continental policies implementation. The purpose of the document also advocates for policy commitment and resource mobilization to AIDS all these diseases by 2030. And I believe what has been said at the opening also shows us how our member states are fully committed and aware about what actions need to be done. So this is also an opportunity for us to recall what has been committed by our member states in an effort to end all these diseases by 2030. Next, please. So the ultimate goal for this plan, as I've just mentioned, is to achieve a healthier and more resilient Africa. But also its mission is quite critical, is to establish universal equitable access to quality health services and HIV and TB, eliminate and eradicate malaria and NTD, control communicable disease and reduce non-communicable diseases in Africa, ensuring an integrated health infrastructure that resilient, university accessible and affordable for all citizens. So emphasis were given through this policy document is the integration because we have seen in several cases our health system is really lacking that issue of integrating all the services at once, which will also aim at reducing duplication, efficient use of resources in all means, being human resource, financial resource, and also information. So this is what's the main and critical mission for that policy document that bringing to our continent. Next, please. This slide has shown the guiding principles, which this document aim also to present to our member state. And allow me just to emphasize and highlight the multi-sectoral response. Health being developmental agenda and increased needs for multi-sectoral collaboration, and being health on top of the priority of Africa's agenda. I believe this issue should be addressed critically and seriously over the next 4 to 5 years, so that we make sure that all other sectors contributing to health, like education, agriculture, and many more, are really involved and making a serious contribution to this agenda. Health as a human right, which also a big call for us, being looking at health as human right for our intervention. That's also one of the very critical guiding principle. Looking at the context of our continents is very critical. And many more of these guiding principles which cut across many of our policy document at a continental level. But I wanted just to highlight these two critical guiding principles for our attention today, also giving emphasis to ending NTDs. Next, please. So this slide will indicate the strategic pillar for this roadmap, and if you see, all the strategic pillars are interconnected, and it speaks to each other when it comes to the comprehensive view of the policy document that really aim to integrate of our health services. Just to mention, strategic pillar 1 call for adolescent children, men, women, and youth, giving more emphasis to these groups in our continent. Strategic pillar 2, health equity and vulnerable population. And we also need to echo what has been said before. Vulnerable population in several occasions are left behind, and this is a very strategic direction for us to really take into consideration our vulnerable group when it comes to service delivery and also inclusion on our planning purposes. The third strategic pillar, access to medicine, regulatory harmonization, and local manufacturing, local and regional manufacturing of medicine, vaccines, and diagnosis. And I think over the last year, we have seen this is also a call from our member states, because when it comes to manufacturing, for instance, manufacturing of medicine in Africa, we are yet to reach the targets that has been put in our documents. And Africa, it's a time for Africa to look at this agenda very seriously if we are to meet our target of ending diseases by 2030. The fourth strategic pillar is, of course, health security and health system strengthening. And in health security, we are also addressing a very critical agenda to our continent, being affected by very many epidemics over the years. I think that is also a wake-up call for us to put it or to give it high priority. Strategic pillar 5, diversified and sustainable financing. And again, I think last year, with the change of financial landscape in our continent, and even before, sustaining health services in our continent, really we need to address health financing. and the Commission at a very high level is advocating for domestic health financing. And that is a drive to make sure that whatsoever strategic intervention we are calling for to end STB, malaria, and other infectious diseases, we really having the efficient resources for us to meet that target. So it's also one of the very critical pillar that this continental framework is emphasizing on. Number 6, of course, leadership, governance, community engagement, and oversight. And this is cut across all the strategic pillar we have mentioned. The last strategic pillar is service delivery, and it is important for our continent to put emphasis on how in our continent or at the level of member state we are delivering our services. We mentioned integration, which one of the key point we want to really make sure that our member state is aligned, and also the tools for them to integrate all the services at once. Next, please. So this is just a summary of what we have been saying since, but just to emphasize, this framework promote integrated services for HIV, TB, malaria, and other infectious diseases, and also builds on one plan, one budget, and one approach, which we call our member state really to align with. Making emphasis to one of our policy documents that call for domestic resource mobilization, which is Abuja declaration that call for 15% target of our budget to be dedicated to health, to meet all the necessary commitments when it comes to health financing. Next, please. So this slide is really to reflect how the roadmap advanced the continental NTDs elimination. And I think from what has been said, accelerating, indicating that accelerating of NTD eliminating through strengthening health system. So the roadmap put a lot of emphasis on strengthening health system, and that will eventually lead to accelerating NTD elimination, because we also have seen in many cases in our continents that when it comes to financing NTDs, they don't have a dedicated budget line in our primary health care. So this is one of the things where we need to really make sure that all our health system, they have sufficient funds for us to plan. Sustainable financing, I think this is just as an example of what I have just mentioned, integrated of NTD into essential health package, that this is also an area where the framework, the strategic pillar for the framework, put it very clear and straightforward. Next, please. So this slide will show member state recommendation from the annual NTD meeting. The AUC, along with its partner, they convene annual meeting for NTD experts. And I believe it's important today to have that reflection of regarding the recommendation that has been put in place by our member state, one of which developed national climate change mitigation plan that incorporate NTD. And I believe this is like a key message from today meeting, if we can call for all our member states to develop national plan that mitigates and incorporate NTD. And there is a lot of opportunity over there when it comes to climate change. Prioritize domestic resource mobilization. I think this is also aligned with what we have said. Promote transparency and accountability from partner to ensure mutual trust and effective service delivery for the most vulnerable group. And here I think there is an indication of really aligning donor fund with the national priority and national plan, strengthening cross-border collaboration and establish robust monitoring and evaluation. Of course, without a concrete data, we will not be able to to move ahead with our planned activity and intervention. Create dedicated budget lines for primary health care. This is, we also mentioned, increase the investment in research and development with an emphasis on generating data from member states. Engage local champion and philanthropy actors to drive domestic ownership and support. Investment in national WASH strategy to achieve sustainable NTDs. And this is again making sure that all sectors they are contributing to NTD elimination are in one table discussing priority. Last but not the least, promote technology transfer and knowledge sharing among member states to enhance local capacity and innovation in the fight against NTDs. And this one also remind me the policy framework we have also just adopted by our member state is the AU Digital Health Strategy 2025-2030, sorry. And this also give us the importance of leveraging digital technologies when it comes to our health agenda. Next, please. So way forward from this presentation, as I mentioned, dissemination of AU roadmap to member state, regional economic and regional health organization partners through continued sensitization and mobilization. This is very key, building the capacity of our member states to implement and domesticate the roadmap in collaboration with the RECs. This is also one of the takeaway message from this presentation. Next. Thank you very much for your attention. Over to you.
Thank you so much, dear Inas, for taking us through the African Union's roadmap. I think I would like to recommend everyone to really go and view this very comprehensive approach on the AU platform. It really outlines the future for NTDs and other diseases as well, but considering different components such as financing, integration, and so on. So once again, thank you so much, Ms. Inas. Next, I would like to welcome Ms. Joy Phumaphi, who is the Executive Director of the of Alma, one of the co-organizers of our session today as well. And she'll be speaking upon integrating NTDs into health systems as well. Over to you, Joy.
Ladies and gentlemen, distinguished partners, colleagues and friends, it is a privilege to join you today for this important discussion while commemorating World Neglected Tropical Diseases Day. This is a special day to fight global inequalities caused by these neglected tropical diseases and ensure that they are prioritized for elimination once and for all. I thank the organizers convening this timely webinar, and I commend you all for your continued leadership and commitment. This commemoration reminds us to call on our political leadership to enhance accountability from the bottom up and from the top down, and eliminate these diseases by making them a health priority for our continent. Today, I want to emphasize one central message. Neglected tropical diseases can no longer be treated as a side agenda. They must be fully integrated into broader health, development, financing, and political priorities. For too long, neglected tropical diseases have lived up to their name, not because of lack of evidence, but because of lack of prioritization. Yet these diseases affect over 1 billion people globally, the majority of whom live here on the African continent. They undermine education, they undermine productivity, they undermine gender equity, they undermine economic growth. They entrench poverty and weaken our health systems from the community level upwards. If Africa wants to achieve the SDG goal of universal health coverage, reaching the hardest to reach. We must end preventable deaths and disabilities linked to neglected tropical diseases. We must unlock the demographic dividend of our youth and integrate neglected tropical diseases into our broader health and development agenda. First, integration with malaria and other priority disease programs is no longer optional. It is essential. Malaria, neglected tropical diseases, maternal, newborn, child, adolescent health, and nutrition all affect the same communities, the same households, and often the same individuals. Yet our responses remain fragmented. This fragmentation costs money, it wastes human resources, it weakens impact. Integrated delivery through community integrated drug distribution and drug procurement systems and supply chain systems, integrated surveillance, integrated prevention interventions, integrated supply chains and data systems allows us to do more with the resources we already have. It strengthens primary health care and increases community trust in the health system. We must move decisively to coordinated, people-centered service delivery. Second, NTDs act as a stress test for health systems and their capacity to deliver equitable health care. Where NTDs persist, it is often because health systems are weak. In hard-to-reach rural areas, humanitarian crisis, border communities, and in informal settlements, where the health systems are often the weakest. Addressing NTDs requires strong community health worker programs and networks, reliable logistics, effective data systems, and sustained financing. In other words, everything we need for a resilient health system. If we build health systems capable of eliminating neglected tropical diseases, we build health systems capable of responding to malaria, HIV/AIDS, pandemics, and any future health threat. This is why NTDs must be embedded within the national health strategies, medium-term expenditure frameworks, domestic financing commitments, and not framed as residual donor-funded concerns. Third, Africa's youth, including National Youth Corps, represent a powerful underutilized force in the fight for health equity. Across the continent, young people are already serving in community outreach, education, surveillance, service delivery. With the right training, coordination, and political support, youth corps can become champions of integrated health service delivery, promoting prevention, combating stigma, bridging the gap between communities and the formal health system, engaging youth in NTD elimination and malaria elimination strengthens not just the systems and the responses, but it strengthens ownership, it strengthens sustainability, and it strengthens accountability. It also sends a powerful signal that public health services and public health and universal health coverage matter. Excellencies and distinguished leaders, this is where political leadership matters most. I want to be very clear. Africa does not lack solutions. What we need is enhanced political will, enhanced domestic ownership, and decisive action. I therefore call on our heads of state and government to elevate neglected tropical diseases within national development and health agenda. Ministers of Health and Finance to integrate neglected tropical diseases into health system strengthening and domestic financing plans. I call on regional bodies and African institutions to champion coordinated cross-border approaches. And I call on our partners to align behind country-led integrated strategies and programs that deliver lasting impact and build sustainability and institutionalize the health response. Africa has shown leadership before in various areas, in HIV/AIDS, in malaria, in pandemic response, whether it be to Ebola or to COVID-19. We can do the same for neglected tropical diseases. But this moment requires courage, the courage to break silos, to align priorities, and to invest in the health of the most marginalized in our communities, because that is where true development begins and ends. Let us commit today to an Africa where no disease is neglected, where no community is left behind, where no young people are excluded from shaping our shared future and destiny. The time for integration is now. The responsibility is ours, and the leadership must come from Africa. Let us all unite, act, and eliminate these neglected tropical diseases, because that is where the Africa we want is. I wish you a very successful commemoration of neglected tropical diseases today. Thank you.
Thank you so much, Joy, for those very inspiring words. I think the need for integration is very clear, and your inspirational words have really put that into strong perspective. Thank you so much, Joy. Next, I have the honor of welcoming Dr. Elizabeth Juma, who is the team lead at WHO's ESPEN. As you all know, ESPEN is very critical in supporting programs in their elimination efforts. And with these changing times and landscapes, they've been really critical in supporting countries through integration, resource mobilization, and ongoing technical support. So over to you, Dr. Elizabeth.
Thank you. Are you able to see the presenter screen?
Yes.
Okay,
Yes.
perfect. Thank you very much. Good afternoon, ladies and gentlemen, and it's really great to join you today to commemorate World NTD Day. Indeed, this is one of the many webinars in a series of the regional commemoration of this day. Thank you very much to those who've spoken ahead. I think the introductions have been quite, important to what I am going to speak to. And just to take you back, that when the roadmap for NTD elimination was developed in 2021, each of the three pillars encompassed integration, whether it was to accelerate programmatic action, intensify cross-cutting approaches, or facilitate country ownership. And during the development of this roadmap and the accompanying NTD elimination sustainability framework, one of the key things that came from stakeholders was that leadership and governance was the most important health system building block for determining sustainability. Leadership and governance, not even financing. And why? Because that is where we will get all our integrative approaches implemented. And so the NTD roadmap really calls for political leadership and governance through political and financial commitment for integration and mainstreaming of these services, and the enhancement of coordination and collaboration across all sectors. For us at ESPEN, the Expanded Special Program for Elimination of NTDs at the regional office, we have elaborated our third generation strategy. And one of the pillars is to promote integration of NTDs into the health systems. And our role therefore remains to support all our country programs in doing this whenever they want that. And why does integration matter? We are at this point when we really are celebrating successes in our region. Over the past 2 decades, we have delivered remarkable progress. we have all these celebrating all these countries that have eliminated at least one NTD. Many have eliminated 3, and Togo has eliminated 4. But these gains are fragile, as has been mentioned. The global health financing landscape is changing. Health systems are under pressure. And as we realized during the pandemic, that we need to build resilient health systems, vertical programs alone cannot sustain elimination. And as we were told before by Ambassador, integration is no longer optional, it is essential. So when NTDs are integrated into primary health care, we have surveillance, integrated disease surveillance for NTDs. When our laboratory systems for diagnostics include NTDs and the supply chain systems cover these, we improve efficiency and we reach underserved populations, and we can therefore protect our gains beyond just achieving elimination. So what does this mean for us in practice? What is our role at ESPEN? We see our role along 4 key areas. One is to support the embedding of NTDs into national health policies. If they are not there, then we cannot even finance them. Nobody will talk about them. To move from the vertical project-based implementation to a national health policy, and through that, help the development of integrated NTD elimination master plans. The second is to support integrated service delivery for NTD interventions, whether it's through health campaigns or through routine service delivery. The third is to really advocate for and support integrated surveillance for NTDs, supporting the integration of strategic health information, and of course, laboratory systems to support case management, particularly for NTDs that are currently managed through preventive chemotherapy, and for whom case management will be the ultimate way to sustain elimination. And last but not least, integrating supply chain and aligning with national logistics systems for all NTD medicines. So, as was mentioned before, integration is key to sustainability and equity. It will bring us efficiency, equity to reach our marginalized populations, and really, we advocate, just as Joy has spoken before, that to ensure that our marginalized populations benefit from combined interventions through primary health care and UHC. And of course, sustainability, integration strengthens domestic ownership and financing of these interventions. And we move from vertical successes, which we have had in the past to sustainable elimination. So we've had examples of this in the last 18 months or so. We have supported South Sudan to plan for and integrate vaccination and mass treatment for schistosomiasis. And late in 2024, supported Madagascar to integrate mass treatment for lymphatic filariasis with polio and vitamin A campaigns. And these were very, very beneficial for both programs. So with that, I hand it back to you. And I encourage us all to take really this opportunity to unite, act, and sustainably eliminate these NTDs for future generations. Thank you.
Thank you so much, Dr. Juma, for that presentation. And thank you so much for mentioning what the practical examples of integration look like, and also sharing the feedback you had received from the various countries that you support. We really appreciate ESPEN's work in the area as well as your perspective. Next, I would like to welcome Sophietou Diop, who is the Partnership and Development Director at Speak Up Africa. She will be highlighting the findings from the NTD Media Forum that Speak Up Africa had organized with Remasen. And that was mainly their primary NTD Day activity, and we're very interested to see what findings they had. So over to you, Sophie.
Thank you so much. My name is Sophietou Diop. I'm Director of Partnership and Development at Speak Up Africa, with many, a non-governmental organization, based in Senegal, working on several, public health issues. Today's discussion on integrating NTDs, into primary health and securing sustainable financing are extremely relevant. But I would like, to briefly highlight another critical dimension of sustainability, one that is often overlooked: visibility, public narrative, and media engagement. Last week in Cotonou, Benin, we convened the first Continental Media Forum on Neglected Tropical Disease, organized with remarks.N, with mainly the African Media Network for the Promotion of Health and Environment. And this forum, brought together nearly 70 journalists from more than 45 African countries, Francophone, Anglophone, and Lusophone, alongside public health experts, NTD program managers, and partners. One of the clearest findings from this forum is that NTDs remain largely invisible in national media landscape across Africa, and more in the Francophone region, despite affecting more than 1 billion people globally, and disproportionately burdening our continent. This invisibility directly undermines, political prioritization, domestic fundings, and long-term sustainability. At the same time, the forum confirms something very encouraging. African journalists are willing to cover NTDs in general. However, many lack access to timely data, trusted experts, and compiling human stories that connect NTDs to broader development issues such as education, sanitation, poverty reduction, climate change, and overall, universal health coverage in general. A second, key takeaway is that media is not simply a communication tool. It's mainly a strategic lever for accountability. And journalists, clearly articulated their role in tracking government commitments, questioning budget allocation, and ensuring that NTDs remain visible even as donor landscape, shift and external financing, declines. And one last thing, I really want to highlight, the discussion we had during this forum, echoed the core messages, of today's webinars. And journalists, consistently highlighted that NTD elimination efforts are strongest where they are integrated into health system, rather than treated, as vertical for temporary programs. They also, emphasize that domestic financing, will only be political viable if the public health, understand why NTDs matter and what we can do, in order to accelerate progress. And during this forum, all of the journalists, many highlight the fact that, they are willing to support, and they will produce, a couple of communication or media pieces that will be, widely disseminated in the continent. And this is mainly a starting point for them. They will work closely with all of the 45, Ministry of Health, to ensure that, NTDs are more prioritized. In conclusion, I would like to emphasize that, ending NTDs, is not only a technical or financial challenges, it's also a narrative challenges, and integration into primary health care, must be matched by integration into national conversation, and political priorities. The experience, of the remarks.N Media Forum show that when journalists, are equipped, engaged and connected to health actors, they can become powerful allies, in sustaining progress towards NTD-free in Africa. Thank you so much.
Thank you so much, Sophie, for highlighting a very important part of the discussions we're having, which is the importance of advocacy and how media within a country would be very important in making sure that NTDs are visible. And through that process, they're included in national budgets, national programs, and they could receive supports towards integration on the road to elimination. Thank you so much, Sophie, for sharing the findings from your recent work. Next, I would like to go to the last presentation, which is going to be conducted by Anthony Bettee, who is the National Program Manager from Liberia and also a member of the Kikundi Community of Practice. So he will be sharing with us the experience of Liberia around the work of integration they've been doing as a practical example of like how countries are going about working on integration. Over to you, Anthony.
My name is Anthony Kerkula Bettee. I am the Director for Neglected Tropical Diseases in Liberia, and I presented on the integration of NTD into the Liberia health system. So Liberia is located in the west coast of Africa, and it's one of the oldest republics in Africa that was founded by free slaves in 1822. The capital city is Monrovia, and it has an approximate population of 5.5 million people based on the 2022 census. So in Liberia, we have 12 of the NTD diseases out of the 25 that we are managing. Rabies, human African trypanosomiasis, the rest of the one you see with the Liberian flag are those ones that have been managed in Liberia. The Liberia program before the integrations, we have the organigram, we had a minister of health, and there were 3 deputies, and then Assistant Minister for Security and Preventive Services, then the county health officer or the community health director. The national program was reporting directly to the county health officers, and then you have various programs at the county level, EPI, TB control, etc. Then you have also at the community level, the leprosy assistant, community health distributor that reported to the county, the officer in charge, and then to the county clinical officer, then to the county health officer. Now for the integration, we have the minister, we have the 3 deputies, the chief medical officer, the minister of planning and administration, and then assistant minister for preventive services and curative services and the county health team. Now, the NTD programs now have an integrated program director, a deputy director, and then we have coordinator for the various NTD program. Then we have coordinator for supply chain and an administrator. So also we have a regional supervisor in the various counties that also report to the case management coordinator. Then at the community level, you have the community health assistant, which report to the community health services supervisor, then to the officer in charge, the district surveillance officer, and the county NTD focal person to the county health team, then to the central. So before the integration, there were vertical programs that was operated by various NGOs and donors. So the support, if you look at the first arrow, the support was leaving from the NGO or donors straight to the community, and also from the ministry to the community. Even the leprosy program, they were supporting straight directly to the community, with all passing through the Ministry of Health. And then it was like everybody was running a parallel program vertically. Now, evidence and rationale for the scaling up of integrated models. So all partner and NGOs now have an integrated platform where we gather all the resources in one basket. So in that way, the Ministry of Health, all funding part to the Ministry of Health, the NTD program now have one master plan for all the NTDs. We have one supply chain system, and then an integrated cascade training that include all NTDs. Even advocacy at the national counties and district and community level are also integrated. Monitoring and supervisions, coordination, as we have the NTD technical working group, we have one. And then tools development for NTD program is also, and then the referral system are all integrated. And then so at this way, the funding leave through the Ministry of Health to the county health team, and then straight to the beneficiary through the health system. So Liberia Integrated NTD program started in 2012. We consolidated management of diseases like leprosy, brutal ulcer, yolks, and lymphatic filariasis, including mobility management and also mental health. It utilizes the community-based approach, door-to-door for mass drug administration, LFT detections by community health worker, training of health worker for LFT detection are also integrated for during mass drug administration, diagnosis and treatment, aiming to strengthening the overall health system while improving patient access to care. So we have one operation plan, the master plan for the neglected tropical diseases, which was developed in 2023 or 2027. And then we have a yearly operational plan for the NTD program for the master plan. And we have one technical working group that was established for all NTDs. And then they group meet every second Wednesday of each month. We also do a joint request for selected medicine for the mass drug administration, medicine, albendazole, and praziquantel for uncle LF and source-permitted hematiasis, schistosomiasis also. For case management, NTDs, medicine have been donated by the World Health Organization, azithromycin tablet for yolks, clarithromycin for brutal ulcer, and MDT for leprosy. So we have challenges, key challenges in during the integrations, which human resource management, which health workers often lack specialized knowledge, training, consistent supervisions to diagnose and manage NTDs. The system vertical system, we rely on donor funding. Prior to the integration in 2012, NTD services was managed through parallel donor-driven program, leading to fragmentations of program and depending on external funding for medications and operational funds. Supply chain was one of the supply chain and logistic bottleneck. The integration of the medicine into the national supply chains has faced issues with bureaucracy, more especially when it comes to transportations and procurement. But for now, all supply are processed through the central medicine store and then are taken to the county by the central medicine store. So geographical infrastructure constraint was also a problem. Poor infrastructure and challenging terrain to make it difficult to reach patients in remote areas, that limiting the service accessibility. Weak data integration was also one. While progression has been made, electronic health system data often fail to include NTD indicators, causing reporting gaps. So, but for now, we have all the NTD data included into the DSIS tools, which is very good for the program. Thank you very much. This is the presentation on the integration of the Liberia NTD into the health system of Liberia. Thank you.
Thank you so much, Anthony, for sharing your country's experience around NTD integration. I think for me, a very important part of what he mentioned is at the end there, that the NTD data has already been integrated into the national DHIS system, which is very important. I think during the various presentations today, you've heard the importance of data and how that's critical, not only in monitoring your work, but also in terms of its importance for advocating for more funding, more resources, as well as making sure that it gets the necessary visibility and support from national governments. So it's really wonderful to see that Liberia has done a lot of work integrating the data. At this point, I would like to thank everyone for their presentations. We're really grateful for our partners for sharing the work that they're doing and also their plans and activities around NTD elimination, integration, the need for advocacy, and also domestic financing. I would like to thank our partners at the African Union Commission, the African Leaders for ALMA, African Leaders Malaria Alliance, WHO ESPEN, as well as Speak Up Africa, and the national NTD program managers who have shared their experiences as well. We would also like to thank you for joining us, taking the time from your busy days and joining us and really engaging with this webinar. As Thomas from ALMA mentioned, we will be sharing the recording for this webinar in around a week's time. So you'll be able to go through all the presentations that have taken place. And as usual, if you have any questions, concerns, or anything you'd like to follow up, you can reach out to any of the presenting partners at our various websites, as well as our various social media presences as well. So once again, thank you all, and I wish you all a wonderful rest of your day, afternoon, or evenings. Bye-bye.